Hello, I'm Rob Jones. I'm Professor of Clinical Cancer Research at Glasgow University, and I'm a medical oncologist specialising in the drug treatment of urological cancers, including kidney cancer. Kidney cancer is an unusual disease. We struggled for many years to find effective drug treatments for kidney cancer. Conventional cytotoxic chemotherapy, such as we may use in breast cancer, lung cancer, bowel cancer, doesn't work. And that's been fairly thoroughly proven to be the case. And then, of course, I guess the breakthrough came about 10 years ago with the demonstration that drugs which inhibit angiogenesis work in kidney cancer. And of course, we now understand quite some detail the link between the molecular biology and angiogenesis in kidney cancer. And so drugs like sunitinib, pazopanib, axitinib, sorafenib have a very clearly established role in kidney cancer. Now, the excitement is that in fact we've now got a whole new paradigm treatment in kidney cancer. Well, I say a new paradigm, but of course before we had these anti-angiogenic drugs, we did understand that immune modulating drugs could be effective, at least in subgroups of kidney cancer. What we now see is that the more powerful class of checkpoint inhibitors seemingly may be particularly useful in this disease. So nivolumab is the drug that's ahead of the game here. This is a drug which inhibits, which is a monoclonal antibody which binds a protein called PD-1. Now PD-1 is involved in the interaction between the body's T-cell immunity and the cancer cell. And it's an off signal of the immune system. And if we use the drug which blocks PD-1, it switches off an off signal, i.e. it switches back on the immune response to the cancer. And we've shown in a large randomized phase 3 trial now in patients who have previously had an exhausted anti-angiogenic therapy that this drug actually seems to give quite a substantial survival improvement for those patients. So I think we're going to see a lot more of these drugs coming through in the near future in the treatment of kidney cancer. In addition, there are new small molecule inhibitors of tyrosine kinases coming through, in particular a drug called cabozantinib, which is slightly different from the other anti-angiogenic drugs. In particular, it targets a protein called MET. And again, this drug has been shown now to improve overall survival in patients who've previously received drugs including anti-angiogenics and indeed checkpoint inhibitors. So in fact, we've now gone from a period where we had virtually no effective treatment available for most patients with advanced kidney cancer to actually now having potentially 3, 4 or even 5 lines of treatment available for these patients.